my patients are leaving a service very happy with their treatment and actually coming off of treatments they've been on for years. Dry eye affects everyone. It's not something that's specific to a particular age group. And to be fair, by the time you have symptoms, the disease is already severe. The Envision platform is a groundbreaking platform which combines both aesthetics and dry eye treatment together. The Lumecca handpiece is amazing. We're treating inflammation, we're treating pigmentation, but this also works directly for eyes as well, because a lot of dry eye is caused by inflammatory changes. You can treat the lids themselves, which is so unique, and because the actual energy is so directed, we can go just up to the lash line, which is revolutionary, which reduces that inflammation in the lids, not only gives you an aesthetic benefit, but also helps the dry eye itself. Now, former eye is bipolar radiofrequency, and the reason that it's so amazing is that not only does it help kind of with the meibomian glands and help with dry eye and reforming that outer protective oil film layer when you're treating the lids themselves, it also stimulates collagen formation. And the fact that you can get the Lumecca eye and the former eye on one platform is what the game changer is here. The technology allows us to enhance the outcome of the treatment, because by treating slightly deeper, we're actually touching those meibomian glands with that radiofrequency energy. We're melting that oil and we're treating glands like we were never treating them before. I actually assessed every single person that worked at Lisa Franklin. Every single person was a candidate for the Envision platform. We all have an element of dry eye, and that's because our lifestyle has changed. We're on a screen all the time. Dry eye isn't just something that is caused by an eye problem. It's a problem that has been caused by inflammation somewhere else. And that's what we offer here. That's what makes us so different. We're treating it from what's going on with your diet, what's going on with your skin, what's going on with your hormone changes. And that's what makes it different, because we are all individually top of our game, but we're bringing all of our expertise together in order to help that one patient that's sat in front of us.